Welcome to Chest Advocates, the podcast that celebrates the unwavering dedication and remarkable achievements of advocates in healthcare, where a single voice, a single story can make a true impact. Thank you for joining us. Now here is narrator Dr. Drew Harris, editor-in-chief of the Chest Advocates publication, to introduce today's topic.
Medicine is more than tests and diagnoses, and being a clinician is so much more than knowing treatments and performing procedures. There is an essential humanistic side of medicine, one that embraces empathy and invites reflection. Celebrating its third year at the upcoming CHEST 2024 annual meeting in Boston, CHEST After Hours invites speakers to delve into the humanistic side of medicine through the art of storytelling. In a recording of a live performance from the CHEST 2023 annual meeting in Honolulu, Dr. Lilit Sargsyan shares her experience in the healthcare system as a patient with thyroid cancer and how it shifted her perspective as a medical professional.
It was the day after my surgery, and I was still hoarse. My 3 little boys wanted to know what had happened to my throat. It looked like someone had sliced it open with a knife and then sewn it back up. I've written a poem since then about how I told them. Waters of Cancer. It was a pirate, I tell them. He tried to slit my throat, but I was too fast and jumped back. Only a superficial slice across my neck in the oceans of this turbulent life. They stare at their mama with jaws hanging open, one of them squeezing out, really? Drawn out long, like the pirate's supposed knife. No, my babies, mama's joking, it was cancer, I croak. What's cancer, mama? Asks one. Oh, so you were lying about the pirate, says the other, with disappointment dripping behind him as he walks away. So what's the truth, mama? Asks the third. I explain how pieces of myself changed and became wrong, multiplied and threatened to take over my thyroid gland. What's a thyroid gland, mama? But we found it early and half of the gland was cut out by the pirate. Still intoxicated and floating in space, I had emerged into consciousness full of hazy humor, mumbling to my surgeon that he was a pirate. I knew he had incised my throat. I'd heard the rumor. I remember an awkward laugh. Who was that from? Calling him a scoundrel was a compliment. In the recesses of my mind, I was at the edge of a cliff overhanging crashing waves, saved by a swashbuckling, knife-wielding seaman, helping me navigate these treacherous tides of life, taking from me loot that was unwanted. Do you still have more cancer? Turns out he hadn't left and was listening behind the door. Not for now, baby, I answer. I'm so glad you met that pirate, mama. Me too, my son, me too. When I was asked how I even knew that I had a thyroid nodule, I used to give a relatively vague answer about subliminal knowledge, ultrasound waves, and fortune tellers. I was embarrassed to tell the truth because the truth smelled of privilege. But the truth wasn't even so bad in retrospect. I had seen it, the nodule. I grew up surrounded by ultrasounds. Both my mom and dad were radiologists by training. And in fact, I was told that I was the very first fetus in the entire country of Armenia to be ultrasounded, a week before I was born. In early 1984, the first real ultrasound machine was delivered to Armenia, and it was entrusted to my father because he spoke English and he was the technology lead for a large diagnostic facility that served the entire population. So what better thing to do than ultrasound his very pregnant wife to discover that they were going to have a daughter? Later, I found out that there was another OB-GYN with a subpar machine who used to charge women a lot of money to tell them the sex of their baby, but I still like to consider myself as the first real quality scan. After that, throughout the years, my parents continued to ultrasound their children, and that's how I got to know that I had a nodule in my thyroid. Fast forward to 2013, I was a chief medical resident attending an ultrasound conference at MD Anderson, Houston. My parents were there because my dad was giving a talk. Manning one of the hands-on sessions was Dr. Beth Ettikin, an interventional radiologist there who biopsied only thyroids and my dad's colleague. After introducing me, my dad, to my chagrin, told her that I had a nodule in my thyroid. She said, "Come by, I'll put a needle in it." The next time I got a glimpse at my thyroid was in 2019 in the summer in Armenia. The Butterfly IQ, the new handheld ultrasound, had just been released to a few early adopters, and I had managed to get one. So there we were across the Atlantic Ocean visiting family, and my parents were systematically ultrasounding all of our relatives as a preemptive measure. And my cousin has Hashimoto's thyroiditis, and her thyroid gland was looking questionable. So in an attempt to show people what a normal gland should look like, my dad put the probe on my neck, somehow landing it directly on my nodule. It took us a second to orient ourselves because the nodule looked different. It looked calcified while it hadn't been before. Suddenly, they were attacking my neck, and my cousin was forgotten. When I got back to the US, I went to my PCP and asked for a formal thyroid ultrasound. I was no longer embarrassed about scanning myself. Ultrasounds were ubiquitous. It wasn't unusual for us to be putting a probe on anyone who would let us, family, friends, ourselves, for any reason. And my PCP obliged, and I got my scan done. She called me a couple of days later, happy. The report was back. The nodule was just 0.9 centimeters. It wasn't calcified, and I didn't need a biopsy. She was happy, but I was confused and concerned. I had seen the calcifications with my own eyes. So I did what I had to do. I went to the imaging center, and I got the study on a disc, and I brought it home. My parents came over. We pored over those images, and there were definitely calcifications in that gland, even though report said that there weren't. My neck was raw and red by the time they were done scanning it, and we didn't trust that report is what we decided, and I wanted a biopsy. So then my dad reached back out to Dr. Ettikin, the radiologist from MD Anderson, who quickly and warmly welcomed me to her suite, saying that she'll just put a needle in it. My parents came with me to the biopsy, and about that biopsy, I've felt some physical pain in my life, but being repeatedly stabbed in the neck without local anesthesia was one of the most jarring and painful experiences that I've had, but thankfully it didn't last very long. Afterwards, we waited in that room. Dr. Ettikin walked back in. The prelim path was indeterminate. She, however, said she didn't like the look of the nodule on the ultrasound, and the pathologist told her he didn't like the look of the tissue, so would I like for her to put another needle in it just to try again? And that was a quick no thank you from me. So she paused for a minute, took her phone out, and she sent an email to a thyroid surgeon and an endocrinologist at MD Anderson asking if they could see me quickly. I remember feeling so grateful that this path was being set out for me, even though there was a real chance that the path was leading me to a diagnosis of cancer. The final path on the biopsy came also back as indeterminate. And this isn't uncommon with some thyroid cancers. The fine needle aspiration just doesn't show it. So I met with a surgeon who gave me a couple options. I could wait another year, have another biopsy, another ultrasound, and go from there. Alternatively, I could have a right hemithyroidectomy, have the right lobe of my thyroid gland excised. I'd already been watching that nodule for a decade and a half, and I was tired of that. I almost felt that surgery was easier at that point than having another biopsy, so I chose surgery. There's a funny quirk at MD Anderson that I saw many times as a trainee in fellowship. Every MD Anderson patient seems to have their MRN memorized, their medical record number. It's not that it's a requirement, but I guess after you've been asked for it about 3,000 times, you just sort of memorize it. So I walked into surgery that morning and I was asked for my MRN and I didn't know it. And I knew in that moment that I would never memorize my MRN. Denial or not, I wanted the need for that question to run out fast. I woke up in the PACU after surgery, pre-op actually. In the pre-op area, the CRNA who was gonna administer my anesthesia walked in. I'd like to mention this because it was heartwarming. It was Julie. I recognized her. She was my kid's old classmate's mom, and we'd known each other for years. We'd been to each other's houses for birthday parties, and it was just a coincidence, really nice to see a kind, familiar face, and she promised to take good care of me. Then I woke up in the PACU after the surgery, and my surgeon was there telling me that the surgery had gone well. My nodule was 1.1 centimeters, and he hadn't found any lymph nodes nearby. I'd be going home in a few hours. My pain was fine at the time, and worse than the pain was me fearing that I would cough and splay open my incision, and my thyroid cartilage and hyoid bone and my left lobe of my thyroid gland, unanchored and lonely, would just all fall out. I remember having a horrifying thought that what if all 4 of my parathyroids had been removed? My brain was fuzzy. I was hoarse, but I was hoping it was the expected kind, just from the nerve having been jingled, and not the permanent kind. And in case you're wondering, I did call my surgeon a pirate because he had slit my throat. And I apologize for that later. I went home. And the next day was my son's meet the teacher event at school. I made myself go. I hadn't thought I would be self-conscious with a fresh incision on my neck, but as I sat in that classroom, I felt like everybody was staring at me. I made it all the way through, but I cried the whole time I walked home. The thing I feared most going into that surgery, other than having cancer and having cancer that wasn't curable, was the possibility of injury to my recurrent laryngeal nerve. This would leave me hoarse, possibly forever, and that absolutely terrified me. There I was, losing control of a lot, my airway, my time, the right lobe of my thyroid gland, and apparently I was also at risk for losing the one thing that was truly my own, the thing that I had spent my entire life strengthening, my voice. My family moved from Armenia to Russia when I was 9. I did not speak Russian. Cautious and shy by nature, with that move, my young voice was fully squelched. I stood out, I was different, and not in a good way. But I had to survive, I had no choice, so I worked to learn Russian and do well in school, and eventually make friends too. And then we moved to the US when I was 12, abruptly. So just for context, the culture shock of the previous move paled in comparison to entering 8th grade in a large public middle school in Houston, not speaking a word of English. And again, I was facing an uphill battle of learning the language, assimilating, finding my people, finding my voice again, and with it, getting some confidence, finishing high school, getting into college, then medical school. And through all those years, learning to speak, then speak up, to trust myself and trust my voice and use it, all of that took a lot of work. So I'm still the same introvert. I've just spent the last 3 decades deliberately practicing to strengthen and amplify my figurative voice. And in fact, it was using my voice in the first place that led me to finding my cancer. And the thought of losing that was like a sick joke. How would I express myself if, along with my physical voice, I lost my hard-gained confidence and my figurative voice? Who would stand up and advocate for my boys and lead them through life if I couldn't? Also, I'm an intensivist. I somehow chose the specialty where my most important tool is my voice, and occasions where I have to raise it aren't few and far in between, and sometimes I just have to yell. How can I run codes if I can't be heard? I was due to return back to the cardiac care unit, the CCU, 9 days post-op. A lot of people code in the CCU. I was worried about compromising their care. So I had gone from being a healthy doctor to a patient with cancer. And I had a lot of anxiety and uncertainty re-entering the world, especially as a doctor. I went back to the CCU, and I kept my voice low. I started every morning in rounds telling my team that I wanted them to exercise more autonomy and just let me stand in a corner and keep my mouth shut. And I don't think they bought it, but they obliged. And as a bonus, I didn't have to raise my voice at all during that stretch. And my hoarseness resolved by the end of the second week. The final path came back malignant. I had thyroid cancer, and although it had been fully removed, I had to advocate for myself to formally discover my nodule and then fight to even have an opportunity at a diagnosis. I had to fight too hard to get my cancer out, and I was really angry, and I felt betrayed by the medical system. I wanted the radiologist who had read my ultrasound report to know what he had missed. And all that with my privilege and my access to medical care and my high medical IQ. And even though the problem of my cancer had been solved, I took another year for my mind to stop reeling from the feelings of anger and betrayal. Throughout that journey, I was so grateful for my knowledge and connections, for my dad connecting me to Dr. Ettikin, who biopsied me so fast. She called me a friend of the family in that email she had written. But even before that, I had the ultrasound machine and the skills to use it. And I had the knowledge and connections to dispute formal recommendations from radiology. I had advocated for myself. But what of all the humans who would have just gone home and moved on with their lives, only later to find out that they had more spread, possibly incurable cancer? What of them not having a voice at all, despite there being no nerve injury? I learned how scary it was to be on that side of medicine and how important self-advocacy was and how important it is for a physician to care for the one person that we tend to neglect the most, our own person. I hope that I will always have the courage to stand up and use my privilege and my voice to advocate for those who don't have the ability to exercise theirs. I was really saddened to learn that Dr. Ettikin passed away early in the COVID pandemic. She was kind and professional, and she was a real patient advocate, and I will always remember her. I no longer have thyroid cancer, and my follow-up these days just consists of an annual visit coming up soon, a neck ultrasound, some labs, visiting endocrinology. Every morning I take my levothyroxine as a reminder of how fortunate I've been, and I still don't have my MRN memorized. Thank you.